Officer at Midland Health. I want to echo something that Russell commented about with the 6-8 nurse line for calling in. It is the access for anybody in the community that has concern about the virus to call and schedule an appointment to go through the drive-through testing center. This also, and as Russell alluded to, you can call there for questions about any other health issues as well. But that's the line for patients to call to get access to an appointment to go through the drive-through. The drive-through does not accept people just driving up. It's really appointed visits only. And any symptoms now, the circumstances have been liberalized. So we had been asking patients about fever and constitutional symptoms that are consistent with a respiratory tract illness. And that no longer is required. It's really any symptoms whatsoever. So if you have symptoms and you're concerned about the COVID infection, you're welcome to call 6-8 Nurse and schedule an appointment. There are over 50 appointments available on a daily basis. And as of yesterday, he's had empty slots available every day. So to the comment of the question that was asked earlier about testing, Russell appropriately answered about the antibody testing, which would show immunity. But there is, as we've spoken about here before, penetration of the infection in the community in asymptomatic people, both pre-symptomatic, and they're going to get sick, but they haven't, and those that never get sick and carry the virus and can shed it. So it's the more testing we do, the more information we have, and the better we can do to manage the disease. I wanted to touch on one other subject that this has been something I've been seeing a lot in the news nationally, statewide, and certainly in our own community as well, is the importance of liberalizing how we're behaving and getting back the economy on track. I think we all recognize the importance of doing that, but I think it's very, very important that we remember this is not some kind of a validation that we have the virus under control. We still have a viral pandemic going on, and it remains a serious threat to all of our citizens, particularly the aged and the vulnerable. But we have to acknowledge also we have an economic pandemic taking place as well, and this is a pretty dangerous circumstance in and of itself. And people above my pay grade and in different lines of work are trying to solve that problem. And I'm just here to remind us that as that problem is solved, we still have a very significant virus. We have a virus that's very transmissible from one individual to another, a virus that can be in one person and not produce any symptoms, but be transmitted to somebody else that does get sick. And in many of those people that get sick, they'll get sick enough that they require oxygen or hospitalization, and a small subset of that population dies. And this is really our responsibility as we do get back to business and get back to work, that we do it in a way that we remember those things and do everything in our power to protect the vulnerable and the aged, get things going in other ways, in every way we can, but be cautious, careful, protective of all our citizens. As we get more testing, we'll have more information, get to the point that we have immunity from either herd immunity because enough people have been infected, or we develop the vaccine. Things can get back to some level of normalcy. But I don't think we'll ever have a completely normal, at least in our lifetime. We'll remember this, I think. And as long as it's still going on as it is today, social distancing, hand hygiene, cleaning surfaces repetitively when you're working in an environment, if you do get back to work, all of those things are very, very important. So congregating in groups is going to remain a very, very risky behavior until we get this under control. So I appreciate everybody paying attention to that as we get things going, as the governor, the mayor, and others make the decisions to move forward. So thank you. I'll entertain any questions.
All right, Dr. Wilson. The first one we have is from News West 9. Sammy said, I'm told MMH is working on plasma donations from recovered COVID-19 patients. Can you explain why this is important?
Certainly. So our pathology department, led by Dr. Klingensmith, has been very active in this area. And the importance is if we recognize somebody has had the SARS-CoV-2 infection and they recover, the reason they recover is because their body has developed an immunity to the infection. For over 100 years, we've recognized that within our blood stream, there is plasma. It's the fluid that carries the red blood cells, the white blood cells, et cetera. And in that plasma, there are antibodies. There's blood clotting factors and other products as well But in the end of at the end of the day, what we're looking for is the antibodies to the virus. And in those that have recovered, and there's specific guidelines on how you look at this, they have to be 2 weeks out from the infection. They had a positive COVID test on the front side, a negative COVID test on the back side. They can donate plasma. And I'm sure you've seen or heard of plasma donation centers. And this is the volume of fluid that is used for coagulation factors. It's used for volume expansion. It's used for a variety of different things. But in this particular role, we're asking it to be used as a therapy because of the antibody. So you're basically using it as an antibody donation. And those antibodies then can be given to another individual and provide passive immunity, meaning they didn't develop the immunity themselves, but it'll wipe out the virus because they have the antibodies to do so. And it's been used around the world in a very limited way. We did a literature search on it, and there's probably been, with this particular virus, less than 50 applications that we were able to find in the literature. I'm sure that's expanding now, particularly in the United States, but that's a pretty small number to know the safety profile. I mentioned that plasma in general is very, very safe to be given. We give it for a variety of other reasons, but whether having passive immunity may shut down your immune system's response and you may not develop active immunity for yourself going forward, for instance. There could be other risks as well. And unfortunately also, there's not a whole lot of people that are aware of this, and there's not a whole lot of people that have recovered from the COVID infection. Remember, this has only been going on in this country for a few months. So, getting the plasma or the serum for everybody that would like it will be a challenge, like every other thing that Russell and others have mentioned about the supply chain. It's going to be a limited product, but when it's available, it will be used in the circumstances that are appropriate, and the FDA has those delineated.
And the next question is from Stewart at the MRT. He asks, how much of a worry is a confirmed test from a second nursing home?
Well, we've spoken about that a number of times over the last couple of weeks here, that our primary concern isn't those asymptomatic carriers and those that have minor illness and stay home in quarantine, but it's the aged and the vulnerable. And long-term care facilities have aged and vulnerable people by definition. So anytime it gets into that kind of an environment, it's of concern. We speak to them on a daily basis. The health department, Midland Health, and the long-term care facilities are working together to try to minimize and mitigate the exposure of others in those circumstances. They're using all the appropriate PPE, and they're keeping isolated patients that are infected. Fortunately, the one that was mentioned by Stewart, that patient has been asymptomatic. He was screened going in because of the concern that everyone has, and the screen came back positive. It was a surprise, but he has been isolated. He's been quarantined, and we hope that will contain the disease in that particular environment.
And now Tasa has a Facebook question.
I have a few questions. I'll start with someone asking about symptomatic versus asymptomatic and the testing that we've done around 900, or we've tested around 900 people. Does that mean that all that have been tested had fever or presented symptoms?
Early in the program, remember, this has been a rapidly evolving circumstance over the last few months, and there are specific guidelines provided by the CDC and others on how to go about managing as we got started. And early on, the guidelines were symptomatic patients with respiratory tract illness symptoms and fever were the ones that were at risk and concern, and those were the ones that were being tested most regularly. As this has evolved in the United States, and there's been many, many cases and a lot of information, observational data coming out of New York and Kings County and Seattle, Washington area, and California and other places, showing the information that we've talked about here now, that the people that are asymptomatic can be carrying the virus and can be shedding the virus and exposing others to it. So in the last week or so, or a little bit more than that now, the criteria for testing have been greatly liberalized. We remain with the supply chain issue. We don't have all the testing we would like to have for everybody we'd like to have it for. If we did, I'd be in favor of screening everyone so we can find out just how much asymptomatic disease there is and how many people are developing antibodies and getting better. But we don't have the capacity for doing that. So we're limiting the testing to those that feel of concern and that need to be quarantined, and obviously those that are being hospitalized or developing symptoms in environments where others would be put at risk.
We have another question. Have you seen an increase in mental health cases in Midland?
Okay, I'm looking at our chief nursing officer. I had not heard of anything along those lines. Kit, do you want to address that question? Sure.